Low blood pressure. Symptoms and treatment. Low blood pressure, or hypotension, occurs when blood pressure readings are consistently below 90/60ths of a millimeter of mercury. While it may seem like a desirable condition compared to high blood pressure, hypotension can lead to various symptoms and health issues, especially if it drops suddenly or significantly. Understanding the causes, symptoms, and treatment options for low blood pressure can help you manage it effectively and maintain good health. What is low blood pressure? Blood pressure measures the force of blood against the walls of the arteries as your heart pumps it around your body. It's recorded with two numbers: the systolic, pressure when the heart beats, and the diastolic, pressure when the heart rests between beats. Normal blood pressure typically falls around 120/80ths of a millimeter of mercury. Hypotension is usually diagnosed when readings consistently fall below 90/60ths of a millimeter of mercury. Types of low blood pressure. There are different types of hypotension, each with unique causes and characteristics. 1. Orthostatic hypotension, a sudden drop in blood pressure when standing up from sitting or lying down, causing dizziness or fainting. 2. Postprandial hypotension, a drop in blood pressure that occurs after eating, more common in older adults. 3. Neurally mediated hypotension, blood pressure drops after standing for long periods, often seen in young adults and children. 4. Severe hypotension linked to shock, a drastic drop in blood pressure that can lead to life-threatening complications like organ failure. Symptoms of low blood pressure. While some individuals with low blood pressure may not experience any symptoms, others may face significant discomfort or health risks. Common symptoms include 1. Dizziness or lightheadedness, particularly when standing up quickly. 2. Fainting, syncope, sudden loss of consciousness due to insufficient blood flow to the brain. 3. Blurred or fading vision, temporary vision problems due to poor circulation. 4. Nausea, often accompanied by a feeling of general weakness. 5. Fatigue, persistent tiredness that doesn't improve with rest. 6. Lack of concentration, difficulty focusing due to inadequate blood flow to the brain. 7. Cold, clammy skin, often seen in cases of shock-related hypotension. Causes and risk factors. Low blood pressure can result from a variety of causes, including 1. Dehydration, inadequate fluid intake or excessive fluid loss from conditions like diarrhea or vomiting can reduce blood volume. 2. Heart problems, conditions such as bradycardia, slow heart rate, heart valve issues, or heart failure can cause hypotension. 3. Endocrine problems, hormonal imbalances, such as adrenal insufficiency, Addison's disease, or low blood sugar, can lead to low blood pressure. 4. Nutritional deficiencies, lack of essential nutrients like vitamin B12, folate, and iron can prevent the body from producing enough red blood cells, leading to low blood pressure. 5. Blood loss, severe injuries or internal bleeding can cause a significant drop in blood volume and pressure. 6. Medications, certain drugs, including those for high blood pressure, depression, or Parkinson's disease, can cause hypotension as a side effect. Diagnosing low blood pressure. Diagnosing hypotension typically involves a physical examination, review of medical history, and specific tests to determine the underlying cause. Common diagnostic methods include 1. Blood pressure monitoring, regular readings to assess the pattern and severity of hypotension. 2. Blood tests, to check for anemia, low blood sugar, or hormonal imbalances. 3. Electrocardiogram, ECG, to detect heart-related issues that might cause low blood pressure. 4. Tilt table test. This test helps determine how your body reacts to changes in position, which can be useful in diagnosing orthostatic hypotension. Treatment options. The treatment for low blood pressure depends on the cause and severity of symptoms. Here are some common approaches. 1. Lifestyle modifications. Hydration. Increasing fluid intake can help boost blood volume, particularly if dehydration is a contributing factor. Dietary changes. Adding more salt to your diet can increase blood pressure, but this should be done under medical supervision to avoid the risk of high blood pressure. Small, frequent meals. Eating smaller, more frequent meals can prevent postprandial hypotension by avoiding large drops in blood pressure after eating. Compression stockings. Wearing these can improve circulation and prevent blood from pooling in the legs. 2. Medications. Fludrocortisone. This medication helps increase blood volume by retaining sodium in the kidneys. Midodrine. This drug constricts blood vessels to raise blood pressure, particularly useful for orthostatic hypotension. 3. Treating underlying conditions. If hypotension is due to another condition, such as heart disease or endocrine disorders, treating that primary issue is crucial for managing blood pressure levels effectively. Preventing low blood pressure. While not all causes of low blood pressure are preventable, certain strategies can help reduce your risk. 1. Stay hydrated. Drink plenty of fluids, especially during hot weather or when ill. 2. Eat a balanced diet. Ensure you're getting adequate nutrients, particularly iron, folate, and vitamin B12. 3. Move slowly. When rising from a seated or lying position, do so gradually to prevent dizziness. 4. Avoid alcohol. Alcohol can lower blood pressure further, so it's best to limit intake or avoid it altogether. When to see a doctor. If you experience frequent symptoms of low blood pressure, such as dizziness, fainting, or fatigue, it's important to seek medical advice. Severe hypotension can indicate a serious health issue, and early diagnosis and treatment can prevent complications. Low blood pressure might not always be a cause for concern, especially if you experience no symptoms. However, when symptoms do occur, they can significantly impact your quality of life and may indicate underlying health problems. Understanding the symptoms, causes, and treatment options for low blood pressure can help you manage the condition effectively. Always consult with a healthcare provider for an accurate diagnosis and personalized treatment plan. With the right approach, you can control low blood pressure and maintain a healthy, active lifestyle.